Good evening to all the viewers. I am Dr. Shweta Ghadge and welcome you all to the IJCP chat show on effect of long-term PPI use on the gut microbiome and the potential effect of probiotics in collaboration with USC Pharmaceuticals. Proton pump inhibitors are frequently used for upper gastrointestinal disorders. The overutilization of PPIs in multiple treatment arenas has exposed patients to an increasing number of potential risks. Therefore, a reasonable approach to clinical indications, dosing, and treatment regimen in each individual patient is required. To share his opinion on importance of probiotics to prevent PPI-induced dysbiosis with us, I welcome Dr. H.M. Rastogi, sir, presently practicing as consultant physician in Meerut. He is a recipient of Meerut Ratan Award 2009, UP Ratan Award in 2021, and Times of India Icon of Health 2021. Thank you, sir, for joining us today. Uh,
Thank you very much.
Yes, so sir, we begin the discussion with the most prevalent question here, sir. That is there a requirement of addition of PPIs as prophylaxis in every prescription to prevent GI disturbances?
Uh, the most important is it is nowadays every prescription you will find a PPI, but there is no need to add PPI in every prescription to prevent GI disturbances. In fact, there are certain indication to use PPI.
Hmm. Right. Sir, correctly mentioned, sir. And also, whether it is a chronic disease, whether it is an acute indication, every prescription has a PPI attached to it to in the lieu of preventing GI disturbance. So, sir, since you mentioned that there are specific indications where PPIs are indicated, so, sir, would you like to highlight certain indications where PPI should be used? And is there an impact on the health of long-term PPI use?
The important indications are related to the either use of drugs or diseases of esophagus or stomach or drugs affecting these areas. In esophagus, it is a main indication is healing of erosive esophagitis.
Hmm.
PPI is highly indicated. Similarly, in cases of erosive esophagitis which has healed, for
Hmm.
maintenance, these are indicated. Another group is non-steroidal anti-inflammatory drug when
Hmm.
used. It is not indicated in each and every prescription of NSAID use. But
Hmm.
if use of these drugs, if associated with dyspepsia, we
Hmm.
will use this.
Hmm.
Similarly, whenever there is a gastric ulcer because of non-steroidal anti-inflammatory drugs, we will use PPI.
Hmm.
And similarly, when there is a increased risk of development of gastric ulcer in patients and we have to give non-steroidal anti-inflammatory drugs, then we will use it. Another
Hmm.
is whenever there is an infection with H. pylori,
Hmm.
this PPI is to be added with certain antibiotics like amoxicillin, clarithromycin, etc. Another is the indications are for short-term use in peptic ulcer diseases. Then maintenance of healed duodenal ulcer, critically ill patients who are on mechanical ventilator. Because
Hmm.
if we don't give PPI, they will develop stress ulcers.
Hmm.
Then hypersecretory syndromes like Zollinger-Ellison syndrome.
Hmm.
And in the last, gastroesophageal reflux disease, where these PPI are needed.
Right. Sir, wonderfully, shared by you the indications, the approved indications of the PPI use. Here, sir, all of these indications are more or less chronic indications. Do long-term use of PPI, sir, have an impact on the gut health and the overall health of the body?
Yeah, long-term use of PPI affects most of the organs of the body. In some, it causes acute symptoms. In another, systemic systems, it causes increased incidence of certain diseases. Like if we first consider gastrointestinal symptoms, it prolonged use is associated sometimes with nausea, vomiting, constipation or diarrhea, or abdominal pain. Although PPI are used for these indications, but these can happen because of PPI also. In There are certain infections related to intestines, like small intestine bacterial overgrowth, also known as SIBO, then in spontaneous bacterial peritonitis. These are the important thing. Another is the Clostridium difficile associated diarrhea. And there are certain other organisms like non-typhoidal salmonella and campylobacter. These are also associated with various GI infections. Now coming to the pulmonary system. This prolonged use of PPI in hospital setting causes increased incidence of nosocomial pneumonia, and prolonged PPI use is also associated with increased incidence of COVID-19. Now coming to the various deficiencies which happens with prolonged use of PPI. It includes hypomagnesemia, that is the decreased absorption of magnesium so that the serum levels is reduced. Then decreased serum levels of B12, decreased serum levels of iron, and it also causes calcium deficiency. Now coming to the CNS side effects with prolonged use. Prolonged use is sometimes associated with headache, increased incidence of dementia, and in predisposed individuals, hepatic encephalopathy. In as far as the cerebrovascular and cardiovascular system is concerned, prolonged PPI use is associated with increased incidence of MI and strokes. For the skeletal systems, it is associated with increased incidence of fractures, osteoporosis, and sometimes myopathy.
Right. So, sir, again, wonderfully explained by you in each and every, organ system how the increased or long-term use of PPIs do lead to, multiple adverse events as just highlighted by you. So, sir, here even because of this overuse, and you also mentioned about Clostridium difficile infections, which is on the rising trend, especially in India. So, sir, would you like to highlight about the US FDA warning on long-term PPI use and the CDI incidences?
US FDA in August 2012 issued a warning with prolonged use of PPI that prolonged PPI may be associated with increased risk of Clostridium difficile associated diarrhea. And it is such an important point that if a patient is on chronic PPI use and his diarrhea is not being controlled on conventional treatment, then we must first think of Clostridium difficile associated diarrhea.
Right. And sir, you mentioned about small intestinal bacterial overgrowth as well. So, sir, combination of medications and in chronic diseases, when a lot of combinations of medications are given, that leads to a lot of GI disturbances, which also leads to small intestinal bacterial overgrowth, which further progresses to IBS, IBD like symptoms. So, sir, due to addition of PPIs, is there a correlation or an association between PPI use and development of SIBO?
Yeah. Before starting with the topic, we must know one term, that is the dysbiosis. Dysbiosis is a condition in which there is a imbalance of the bacteria in the gut. There are two types of bacteria. One are the good bacteria and another are the bad bacteria. And with prolonged use of PPI, these good bacteria decreases and there is increase in the bad bacteria. And this increase in the bad bacteria is known as small intestinal bacterial overgrowth.
Right.
When PPI are given, it causes gastric acid suppression. And this gastric acid is a barrier to various bacteria and causes killing of various bacteria. Because it is mentioned in textbooks that if pH is less than 4, then this bacterial overgrowth will not occur. And these PPI causes increase in the pH. And with this, there is overgrowth of bacteria in stomach and duodenum, and which leads to SIBO and dysbiosis. And this, when occurs, is associated with certain symptoms. Uh, if this SIBO is prolonged, that is chronic fatigue, digestive problems, dysuria, acid reflux disease, vaginal or rectal infection or itching, then food intolerance, gas production, bloating, various arthralgia, various type of skin rashes, increased incidence of acne and psoriasis.
Right, right. So, sir, there is, a lot of issues with SIBO and complications associated with SIBO, and addition of PPIs do increase the chances of SIBO. And here, sir, the another indication is of gastroparesis, sir. So, lot of motility disorders occurring with PPI overuse, and gastroparesis being one of the most common, scenarios in clinical practice. So, in your clinical practice, sir, is there a common correlation between long-term PPI use and development of gastroparesis?
Yeah, it is a very common finding with prolonged PPI use. PPI causes delay in the gastric emptying by 15 to 40%. And it uh, why it happens? Because PPI inhibits the acid secretion, and because of this inhibition there is decrease in the hydrophilic digestion of the food particles. Hmm? And similarly, uh, because of high pH, the acid dependent peptic activity is reduced, and thereby there is delaying in the digestion of the solid foods, and there is a slow gastric emptying.
Right. Right. So, sir, all of these complications, SIBO and gastroparesis and CDI, all of these complications, deteriorate the quality of life of the patients. So, and the available treatments, in terms of antibiotics or in terms of reducing the PPI use, they do not generally cure or improve the quality of life of the patient. So, sir, here the addition of probiotics as a treatment strategy for PPI-induced dysbiosis. So, what is your opinion on that, sir? Can probiotics be used?
Yeah, as you have already mentioned that if there is a dysbiosis, it can be treated with various antibiotics like ciprofloxacin and rifaximin, but
Hmm.
it
Hmm.
causes only acute improvement. For chronic
Right.
improvement, we must add probiotics or and various nutrient like prebiotics. And these the combination of this prebiotic and probiotic is also known as symbiotic. When in given in proper doses, it causes uh, improvement and treatment of dysbiosis because it maintains gut microbial homeostasis, and in the gut it activates or the innate and adaptive immunity by signaling antimicrobial and inflammatory responses, so increasing the control of dysbiosis. Then these probiotics also stimulate the production and secretion of mucin and cathalicins and defanicins from the goblet cells. And these forms an immune barrier over the surface so that there is prevention of invasion of by pathogenic bacteria. These probiotics also help in increased expression of genes so that there is a increased expression of tight junction protein, and this reduces the damage to the gut tissue caused by various bacteria and viruses like E. coli and rotavirus.
Right, sir. Again, wonderfully explained and important for audience to know that probiotics, through multiple mechanisms, not just one mechanism, but multiple mechanisms, does help in alleviating the symptoms of dysbiosis, gut dysbiosis, and it restores the gut health, and therefore, sir, here, does it improve the overall quality of life of the patient, sir?
Yeah, the as far as the quality of life is concerned, there are two types of quality of life. One is the physical, other is the psychological. In various studies, it has been found that these probiotics causes 64% improvement in physical health, and similarly also helps by in psychological health by 14%.
Right, right. So there is an improve. So with improvement in gut dysbiosis, there is an improvement of the physical health and the psychological health, and therefore the overall improvement of quality of life of the patient. So again, important for the audience to know that probiotics, through multiple mechanisms, provide the adequate good bacteria to the gut and improving the gut health of the patient, and improves the overall quality of life. So, sir, since we discussed, that PPIs are a leading problem in causing gut dysbiosis and the multiple complications of gut dysbiosis. So, here, sir, can probiotics be added or given in co-prescription with PPIs to prevent gut dysbiosis or PPI-induced dysbiosis?
Yeah, when we combine these two drugs, probiotics are very helpful in preventing dysbiosis caused by PPI. But the important point is these two drugs must not be given at same time. There must be at least 2 hour difference. If we are giving PPI, as we always give PPI first, then this probiotic must be given at least 2 hours after, minimum 2 hours after this PPI, and it causes improvement in dysbiosis and prevent dysbiosis.
Sir, since you mentioned that the frequency to be separately given for PPI and probiotics, in terms of duration, sir, how long should probiotics be given, and when should it be initiated? It should be initiated with PPIs or after completion of course of PPIs?
You see, usually what happens, the prolonged use of PPI, uh, mm, if we have to use prolonged PPI for long time and there is a development of dysbiosis, then we can start both the drugs at the same time. Uh, mm, but at
Right.
timing will be different on the same day. And as we know, these probiotic also reduces the acid secretion and reflux. So ultimately, we can withdraw PPIs, and it is a very difficult question for how long it is to be given. But in literature, it has been mentioned it from 2 months to 6 months after stopping PPI, it is to be given.
Right. Right. Again, the duration is important, and frequency also, as sir mentioned, should be considered. Sir, since every prescription now contains a PPI to prevent GI disturbances, which is ultimately leading to complications in patients, and they don't understand that it's because of the prolonged use of PPIs is why they are facing the GI disturbances. So instead of a PPI, can probiotics be given to prevent or as a prophylaxis to prevent GI disturbances?
Yeah, it can be given to prevent the dysbiosis if we know that these PPI are to be given for long time.
Hmm. Right, right. Right. So again, again an important point highlighted by Sir here is that PPIs do lead to a lot of GI disturbances, and although they are added to prescriptions to prevent, they do not, for a long term, it does not really cure the GI disturbances, but rather creates a GI disturbance. And for that, probiotics can be used instead of a PPI in long duration of course of different medications. Sir, again, thank you for wonderfully sharing such great information here with us. Sir, would like to understand your clinical experience with a chronic case of say PPI induced dysbiosis and how probiotics addition has helped.
Uh, Nowadays, probiotics are used quite frequently in such cases, and we have found with the use of probiotics, the symptoms of dysbiosis improves. And with this knowledge in background, not only I but most of the physicians have started using probiotics in patients who are using prolonged PPI and develop dysbiosis, and there are excellent results, and the symptoms improves with use of probiotics.
Right. Wonderful, sir, to know that you've had a positive experience in your clinical practice with addition of probiotics in a PPI-induced dysbiosis state. And also, the points highlighted by you, especially with complications of PPIs and long-term PPI use, and how dysbiosis leads to the deterioration of quality of life of the patients, and addition of probiotics here is like a boon where it creates a normal gut flora, and therefore improves the quality of life of the patients. So extremely important for audience to know that probiotics are beneficial, and when given with PPIs, it actually helps in improving the GI disturbances and the symptoms related to GI disturbances. Sir, I would like to know your final message that you have for the viewers.
Yeah, as we know, the PPI are the drugs which are commonly used nowadays, and these PPI decreases the pH, and with this decrease in the pH, increases the pH, and with this increase in the pH, there is a increased growth of the various pathogenic bacteria. Not only the pathogenic bacteria, but those bacteria which are commensal, mm, uh, in increases in this, and with this increase in the harmful bacteria is associated with development of dysbiosis, SIBO, spontaneous bacterial peritonitis. And to uh, treat this, probiotics are the very good drug. The one most important point is a clinician must be vigilant and alert to diagnose dysbiosis. And similarly, if a diarrhea is, as we have already discussed, if a patient is on prolonged PPI and diarrhea is not responding to the conventional treatment, we must think of Clostridium difficile associated diarrhea, and prebiotics are definitely indicated in these drugs.
Right.
Similarly, with prolonged use of prebiotics and probiotics, we can prevent development of various these bacterial overgrowth like infections, and this will definitely improve the quality of life of the patient.
Thank you, sir, for sharing your insights and experience, and for the wonderful explanation on the severity of PPI-induced dysbiosis and how addition of probiotics will actually help in improving the patient's life. Quality of life. Thank you, sir, for joining us and for taking the time out and for giving such wonderful explanation to the long term use of PPIs on gut microbiome and effects of probiotics. So, thank you, sir.